So for today, we're going to be doing lower extremity peripheral vascular examination. So first, the patient's going to be supine-ish, but for the sake of getting everything on the camera, we're going to have the patient seated like so. We're going to do an external evaluation of the skin, the veins, the arteries, the toes, the nail beds, checking for any sort of deformities, changes in color, changes in hair growth patterns, looking if there's any sort of atrophy of the muscles or any additional like excess fat pads. Everything seems pretty normal in this healthy individual. After we've done our observation, we're going to move to hands-on. I'm going to check for the temperature of her feet, her legs, her knees, her legs, etc. on both sides. As far as today, her toes are a little bit cold, but that makes sense because the house is a little bit cold and there's not too much circulation in the feet compared to in the upper leg with the muscles. I'm looking for any sort of trophic or skin like thickness changes that might indicate problems with circulation, any sort of edema. Patient seems healthy, it feels fine. There's no pitting edema. If I were to check that, I'd be checking the medial malleolus on both, holding it for 4 or 5 seconds, letting go, looks fine. I would check the shin, 4 or 5 seconds, looks fine, and then finally the dorsum of the foot, hold it for 4 or 5 seconds, and it also looks fine. Now that we've palpated that, we're going to go on to the pulses. So the first pulse I'm going to check is dorsum. So I'm going to find it there. And if I was doing a real pulse check, I would hold it for 30 seconds and then compare it. I'm also going to do it on the other side. This foot especially, just because that's the only one I checked, had a rather strong pulse, so that's great. The next pulse we're going to check is behind the ankle. There it is. That one feels good too. Next we're going to move up to the popliteal. So the technique we were taught in class is I'm going to pull superior and then pull towards me to find it. And usually you'll find it on the lateral finger. I have a little bit more difficulty finding this one, even when I pull it against the tibial bone, but that is where the popliteal pulse should be. Next I'm going to ask the patient to lay down flat for me, and I'm going to go on to the femoral pulse. So, let's see, we're still in view. So if you could roll up your shirt slightly for me, and then roll your pants down to comfort. I'm going to come down to her groinal ligament, finding her femoral pulse, nice and strong. And then I would also palpate to the other side, but for the sake of brevity, we're just going to do it to the one side. While I'm here checking the femoral pulse, we can also check the lymph nodes of the area. So there are some that are just inferior to the inguinal ligament, and then there are some that are going up, down along the vertical group. So I would check those too. We're also going to listen for any sort of bruise on the femoral pulse. So we're here. If the patient wasn't overly comfortable, they could make a barrier for themselves. I'm going to lift up her garment, stick this underneath, feel for the pulse without staring intently in the area, making them feel uncomfortable. So I would lift, come in, checking for the pulse. I don't hear anything, which is the good sign. Let's see, what was there next? Special tests. So if there was any sort of pain going on with the patient, we can do a couple different special tests. If I suspected them of a hernia while I was down here in the femoral region, we could have them turn their head and cough and see if there's any sort of bulging, any sort of pain sensations that come from there. Let's say there's not. If they're having pain sensation in their legs, I can lift their leg up like so, and then I can apply a squeezing motion to the calf and see if there's any sort of pain associated with that. For the next one, I would have the patient bring both their legs up, and they would do their best Nemo impression, and they would just keep swimming for about 60 seconds. But for the sake of brevity, they won't do that. And when they're done after their 60 seconds, they're going to spin around to the edge of the bed, edge of the bench, put their feet down, and we're going to observe the color changes not only in their foot, but also in their toes. We're going to look for venous refill on both feet and see when there starts to be color returning to the feet, the toes, and then coming back up to the legs. So yeah, that would be the conclusion of our lower extremity peripheral vascular exam.